Hi everyone, I'm Dr. Akhila, consultant fertility specialist at the hospitals, Banjara Hills, Hyderabad. Today we are going to talk about the role of hormones in fertility. Achieving a pregnancy is a remarkable thing and quite a miraculous occurrence in a couple's life. And one of the most important things in achieving a pregnancy is that the level of hormones. So let's understand what are hormones. Hormones are chemicals that are secreted into the bloodstream by the endocrine system, and these hormones orchestrate a lot of functions in the body and including reproductive functions. So in males, the important hormone is definitely the testosterone, along with the FSH and LH. And these three hormones put together help in sperm production, spermatogenesis, and these are the hormones that we usually check for in males, along with thyroid and TSH, prolactin levels are also tested in a male, importantly, the semen analysis. Now, coming to the hormones related to fertility in males, there are four important hormones, that is the FSH, LH, estrogen, and progesterone. So, these four put together, they bring about ovulation and thereafter pregnancy. So the cycle, that is the menstrual cycle, is divided into two parts. That is the first half of the cycle, which is the follicular phase, and the second half of the cycle, which is the luteal phase. So the follicular phase starts from the first day of the menses, and the hormone that is secreted is the FSH, that is follicle stimulating hormone. It is secreted by the pituitary, and this hormone acts on the ovary to help get that one dominant follicle to grow. And once it starts growing, estrogen increases. So put together, the FSH and estrogen, they cause the growth of the follicle, the one follicle, dominant follicle. Once the follicle starts to grow, the estrogen increases, and it also helps in development of the endometrial thickness. The endometrial lining also increases. And once the follicle reaches a particular size, and there's another hormone, that is luteinizing hormone, again secreted by the pituitary, that comes into action. So the role of LH is that it causes maturation of this follicle and helps in the rupture, which is ovulation. Normally this happens on about day 14 in a 28-day cycle. So once the follicle ruptures, estrogen levels come down, FSH levels come down, and a corpus luteum is formed, which now secretes progesterone. Progesterone doesn't allow the endometrial thickness to increase further. It luteinizes the endometrium and prepares the endometrium for implantation. It brings about secretory changes in the endometrium. And this should this follicle after ovulation fertilize, then uh, the embryo is formed and it implants, and progesterone levels further increase from the corpus luteum, and thereafter the placenta takes over to increase the progesterone levels to maintain the pregnancy. If there is no fertilization, the corpus luteum degenerates and it brings about menstruation, and this cycle repeats. Apart from these four important hormones, like in the males, even in the females, the thyroid levels, that is the TSH, prolactin, also have to be normal. Uh, Along with these, even testosterone, there's a little bit of androgen testosterone, even in the female endocrine system, which plays an important role. The low levels of testosterone help in recruitment of these follicles in the initial part of the cycle. Now, these testosterone levels are quite high in other conditions like PCO or adrenal problems and things like that. So these are essentially the hormones that bring about a menstruation, and the levels of these hormones have to be balanced so we can expect a fertility process in the female. Now, alongside, what we must understand is how do we regulate, how do we monitor, or how do we use these hormones to understand. So, estrogen is very important in fertility treatments. We usually order for the estrogen tests to understand the process and the to understand the response of the drugs that we give. Sometimes estrogen is very high in conditions like ovarian cancers, and the baseline estrogens also we check at the start of the cycle, in between the cycle, to figure out the response of the drugs that we give. These are some of the uses of the hormones, and then we do the testing. This is in short about the role of hormones in fertility. Any questions, please? Definitely, it could be a hormonal issue. Once every 3 or 4 months, it indicates anovulation. You need to get these hormone levels tested, the FSH, LH, estrogen, on preferably to do all these three on the second or the third or fourth day of the cycle. Also, the prolactin levels and the thyroid PSH levels, excess of any exercise or stress or weight loss or weight gain. These are some of the other causes that can bring about irregularity in your cycles, apart of the hormonal causes that are in there. Um, it could be hormonal change also, that you're experiencing mood swings and these kind of conditions. It depends on how regular or irregular your cycles are. If your cycles are regular, then relatively it could be a non-harmonious cause. The cycles are irregular, obviously you need to get the hormones tested and work it up accordingly. Why are my hormones levels frequency fluctuating? Is this abnormal? No, hormone levels are naturally fluctuating. So in the beginning of the cycle, the estrogen levels are low and FSH levels are low. They begin to rise in the first half of the cycle, that is the 14 days, which is in a 28-day cycle, which we call as the follicular phase. That's when the estrogen, the FSH and the estrogen, they rise. And once the follicle reaches a good size, that's when the LH rises and it falls. Once it falls, we expect ovulation in that period, and thereafter there is a slight rise again in estrogen and FSH, and it again falls. And when this rise happens for the second time, that's when the progesterone also increases, and then the progesterone falls if there's no fertilization, and because of this fall in progesterone, which is progesterone withdrawal, that's when the menstruation happens. So these fluctuations in hormones is a very natural occurrence, and that's what maintains the cyclicity. So feeling tired and moody most of the times could be related to your thyroid levels, um exercise, uh, mostly maybe the hormone levels. So these are some of the things that you need to test, and then accordingly find out if there is any pathological cause or it's just physiological. So, premenstrual syndrome, when it is mild, that's normally what happens is when we have ovulation, we expect a certain kind of change, what we call as premenstrual monomania. So we know that we're getting a period. So when these kind of symptoms increase that are unbearable, that's when it falls into the spectrum of PMS or PMDD. These kind of symptoms become unbearable. The pain or the mood swings or the irritability, which hampers your daily routine, or it even becomes very uncomfortable for people around you. So that's when it falls into this spectrum, and lifestyle changes can help in trying to curtail these symptoms, like regular exercise, and of course, testing of hormones. If any of these hormones are not within the normal range, drugs for the same, uh, and certain antipsychotic drugs also can be used alongside, and counseling plays a very vital role. Hormones regulate normally after menopause. After menopause, there is still some amount of estrogen that is secreted, and this is not typically from the ovary. So we have peripheral conversion of estrogen that is from the testosterone. So that is why I was telling you there is a little bit of testosterone even in the female body that is useful. So this peripheral conversion of testosterone into estrogen helps in menopausal women. So you're married for 9 years. Definitely, it you need to be tested, a semen analysis, and an AMH, thyroid, prolactin, sugar levels need to be tested in the female, along with a scan. Depends on what the age is of the female and the male. If the egg count is normal or borderline normal, then based on your age and the semen analysis is also normal, probably we can try 1 or 2 IUI cycles. Otherwise, maybe an IVF looking at 9 years of married life. It may also be worthwhile to consider a hysteroscopy or a laparoscopy. Tubal testing is also essential. So the workup needs to be completely done in this scenario. Hormonal imbalance would mean when the hormones are not in the range that they're supposed to be. So there is a time at which we even test these hormones. Some of these hormones are done in the morning hours. Some of these hormones are done in the follicular phase of the cycle. Some of these hormones are done in on day 2, day 3, day 4 of the cycle. So when we do these hormones at that particular time, there's a range that the hormones need to fall into. So if they are either less or more, that's when we call it as hormonal imbalance. Thank you.